Okay, let's dive in. We've got this stack of sources you sent over, and wow, it really covers a lot of ground in healthcare. We're talking quality, patient safety, accreditation.
Right. And the companies that help make it happen, consulting firms, plus some, well, really practical advice too.
Exactly. We've got info on big global players like Joint Commission International, JCI.
Mm-hmm. And national ones like NEBH in India. Then there's Supremedic Consultancy.
Yeah, and the HospiManage blog showing the sheer variety of topics.
And even specific tips from Lifelines by Supremedic on something really intense, like managing panic in the ER.
It's quite a mix. So our plan here is to unpack all this, pull out the key stuff, maybe some surprising bits, and basically give you a quick way to get up to speed on these, well, pretty critical healthcare areas.
Sounds good. Let's start at the top then, with the bodies that set the standards.
Perfect. And right away, the sources point to Joint Commission International, JCI. Seems like a huge name globally.
Oh, definitely. And their mission, it's stated pretty clearly, to enable and affirm the highest standards of healthcare quality and patient safety for all. That for all is quite a global reach.
And the numbers back that up, right? The sources say working in over 70 countries.
Yeah, across, well, pretty much everywhere. Asia, Europe, Middle East, Africa, Latin America.
Wow.
They've accredited or certified, I think it was over 1,000 programs, and they've got like 600 plus experts helping them worldwide. That's a serious operation.
So what do they actually do? I mean, beyond just existing?
Well, they rate the standards, obviously, rigorous international standards, and they seem to really focus on their international patient safety goals.
Okay, what are those about?
The sources explain they're designed to zero in on the, quote, most problematic areas of patient safety. So, finding the biggest risks and building goals around them.
Smart. Identify the weak spot.
Exactly. And then they offer accreditation, certification programs, things like clinical care, healthcare sustainability. I saw telehealth certification mentioned too.
Telehealth. Interesting. Makes sense now.
Yeah, plus advisor services, education. They publish manuals, white papers, do webinars. It's a whole ecosystem to help hospitals actually use the standards.
And does it work? I mean, what do the hospitals say?
Well, the testimonials included are pretty telling. One called JCI accreditation, one of the best team-building exercises.
Team building. That's not what I'd expect first.
Me neither, but it suggests it really forces everyone to work together. They also mention, the more expected things: competitive advantage, community confidence, better risk management, and risk reduction.
Okay, that makes sense.
And importantly, creating a real culture of patient safety. So it sounds like it goes deep.
Right, not just ticking boxes. It's about changing how the whole place operates. So that's the global view. What about specific countries? The sources mentioned NABH for India.
Yes, NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
And they're part of the Quality Council of India.
Correct. Their focus is specifically on India, establishing accreditation programs, setting benchmarks for the industry there, catering to what consumers in India need.
And who backs them?
It says they're supported by stakeholders like industry, consumers, government, but importantly, they maintain full functional autonomy.
Ah, so independent but informed by everyone.
Seems like it. And like JCI, they offer resources. You can buy their standards, learn about accreditation benefits, see who's accredited, get training.
So we've got JCI globally, NABH for India. Different scales, but the same basic idea, right? Setting standards, checking if organizations meet them, all aiming to boost quality and safety.
Exactly. They define what good looks like and why it matters.
Which naturally leads to, okay, how do hospitals actually do all this?
Yeah.
Implementing these standards, running things day to day, that brings us to the consultants.
Right. And the sources introduce Supremedic Consultancy Private Limited. They're described as a trusted partner for hospital owners, offering comprehensive support.
And they seem to work with everyone. Small clinics, big multi-specialty hospitals, diagnostics.
Yeah, the scope seems really broad. And their services list, it's long.
Like what?
Everything from the very beginning. Planning and designing hospitals.
Okay. Foundational stuff.
To crucial operations, like recruitment of doctors and nurses, even manpower planning.
And connecting back to what we just discussed.
Exactly. Quality management system implementation. They specifically mention helping with NABH accreditation and NABL for labs too. Plus, things like medical equipment calibration, healthcare business consulting.
The SOAR operations, compliance.
Even legal and ethical compliance support. They seem to cover a lot.
Okay, but here's something that jumped out at me from the sources. their business model,
Yeah.
taking equity.
Yeah, that was interesting, wasn't it? They mentioned taking equity as our fee and positioning themselves as an investor collaboration partner. The idea is to bring innovative healthcare solutions to life.
Taking equity. I mean, that's a serious commitment. It's not just consulting hours then. They're literally invested in the success of the project.
Totally. It suggests they're pretty confident they can deliver results that justify that kind of partnership. It's definitely more than just standard consulting.
Right, like a development partner almost.
And they also list specific products. They handle modular operation theaters, medical gas pipelines, equipment, furniture, so they can really help build things from scratch or upgrade facilities.
So the benefits they list, comprehensive service, expertise, efficiency, regulatory help, it all kind of fits this picture of being a deep partner.
Makes sense. And the sources mention related brands too, like hospicamp.com, doctokoj.com.
Hospilearn, HospiMatch.
Yeah, those names suggest they might have platforms for supplies, finding doctors, learning, maybe matching needs, part of a larger ecosystem.
Okay, so you have these standard setters like JCI and NABH. Then you have firms like Supreme Medic helping hospitals meet those standards, run smoothly, and even launch new ventures with skin in the game. It shows these different layers supporting the system.
It really does. And ultimately, all these systems and consultants, they're aiming to make the actual patient care better and safer.
Speaking of the breadth of care, let's shift to that HospiMatch blog list.
Yeah.
It's not just a list of titles. It tells a story about what's going on in healthcare.
Totally. It gives you a real sense of the complexity. You've got, like, healthcare financing options right next to managing chronic diseases through hospitals.
Right. Or latest trends in patient care and hospital management. That's very operational, alongside really specific clinical services like pain management programs or speech and language therapy.
And specialized care for seniors, mental health advancements.
Oh yeah, mental health was on there. That's crucial.
Occupational therapy, physical rehab centers, and then technology, like the latest medical imaging, x-rays, MRI, CT, PT-CT, specifically mentioning their availability in India.
It really paints a picture of how diverse modern healthcare is. It's
Yeah.
way beyond just fixing broken bones.
Yeah.
It's long-term management, specific populations, mental wellness, cutting-edge tech, complex finances.
Absolutely. For you listening, it underlines that healthcare isn't one thing. It's this huge, intricate network of specialties and services. Understanding the standards and consultants gives you the structure, but this list shows the scope of what that structure supports.
And dealing with that scope, especially when things go wrong, can be, well, overwhelming. Which brings us perfectly to that last piece from Lifelines by Supreme Medic, the really practical stuff about panic in the ER.
Yeah, this one feels very immediate, very human. Because let's face it, emergency rooms are stressful places. Feeling fear or panic, that's normal.
Totally normal. But the core message here is so important. Composure helps. They quote, "In a medical emergency, clear thinking saves lives. Panic doesn't."
Such a vital point. And the source breaks down why people panic in the ER, fear for a loved one, obviously, but also confusion about the process, the chaos, maybe unclear communication, worries about cost or waiting time.
Yeah, all those things hit you at once.
So to help with the confusion part, the source gives a quick rundown of the typical ER flow. Starts with triage nurse, figures out how urgent things are.
Right, the first stop.
Then initial care getting vitals, maybe starting an IV. Then stabilization if needed, and finally, the doctor review for the detailed assessment.
Understanding that flow helps. And the source makes that critical point about triage, the one that causes so much anxiety. The sickest are treated first. This may delay care for less urgent cases.
Exactly. Knowing that delay isn't neglect, it's prioritization based on need, that might help manage the panic a bit.
Okay, so knowing the why helps. But why is panicking actually bad in that situation?
Well, the source lists clear reasons. First, it messes up communication. When you're panicked, you might forget vital info medications, allergies, timelines.
Oh, good point. Crucial details get lost.
Second, it stresses out the staff. Blocking hallways, demanding attention, arguing. It disrupts their focus and can impact everyone's care.
Right, they need to focus.
And maybe most importantly, it can terrify the patient even more. They pick up on your cues. If you're freaking out, they're likely to feel much worse.
Okay, so definitely detrimental. Now, the important part, how to stay calm. The source gives actual steps.
Yes, really practical stuff, like just take a deep breath. It even suggests a technique. Breathe in for 4, hold for 4, breathe out for 6, something concrete you can do.
I like that. Simple, actionable.
And focus on facts when talking to staff. Speak clearly. Give them the info they need. He collapsed 15 minutes ago. She takes blood thinners. No known allergies, blood type B positive, just the facts.
You keep it concise and clear. What if there's a whole family there?
Good question. The source suggests assigning roles. One person stays with the patient for comfort. Another handles the paperwork and talks to doctors. Maybe a third person updates other family or handles logistics. Share the burden. Give everyone a job.
Smart. Divide and conquer the stress.
Yeah. And there's advice on just managing the feeling itself, acknowledging panic is temporary, using breathing, relaxing muscles, grounding techniques,
Okay.
communicating your own needs, seeking support later if needed. But maybe the biggest piece of advice is about preparation.
Before you even get to the ER.
Exactly. Keep an emergency file, basic medical history, insurance details. Know where your nearest suitable hospitals are. Have ICE contacts saved in your phone. Talk about family medical history before a crisis hits.
That makes so much sense. Because as the source puts it, preparation gives you clarity, and that's the enemy of panic.
Yeah.
Reduces the unknowns.
Totally. And it also lists things not to do. Don't yell or blame. Don't crowd the staff or patient. Don't use phones where you shouldn't. Don't demand to jump the queue without a medical reason.
Right. Basic ER etiquette, but easy to forget when stressed.
And finally, what family can do. Stay calm to comfort the patient. Pick one spokesperson to talk to staff. Be patient. Remember triage. Ask where you should wait and how you'll get updates. It's all very straightforward, but potentially life-saving advice. It really ties everything together, doesn't it? All those high-level standards from JCI and NABH, the operational help from consultants like CU45, the vast range of medical services. It's all meant to build a system for better care.
But in that critical ER moment, your ability to stay calm and provide clear information, as this Lifeline source suggests, becomes absolutely crucial for navigating that system effectively.
Exactly.
So we went from the global standard setters
To the national bodies, like NABH.
that looked at the support crews, the consultants like CU45 who help make it happen, sometimes even as investors.
We glanced at the huge variety of healthcare topics from that HOSPI match list, showing the sheer breadth of the field.
And we ended up with some incredibly grounded, practical advice on handling one of the most stressful healthcare experiences imaginable, the ER visit.
Yeah, it's quite the journey through the layers of healthcare.
And hopefully understanding these layers from the big picture quality goals down to the personal actions you can take in a crisis helps you feel a bit more equipped, a bit more confident in navigating it all.
You know, it's fascinating to connect the dots. That abstract vision from JCI, zero harm and highly reliable care delivery.
Yeah.
It's ultimately about trying to make sure that when you're in that ER or any care setting, things go as well as possible. The system supports the moment.
It makes you think, doesn't it? How all that formal structure, the accreditation, the consulting, it's all in service of those critical human moments. So that maybe, just maybe, when you need it most, you can follow that advice. Stay calm, stay informed, be your loved one's strength.